We are joined now by Dr. Todd Ellerin, Director of Infectious Diseases at South Shore Health, to talk about COVID-19. Now, South Shore Health among the local hospitals receiving their first vaccine shipment today. What's the mood among staff knowing they could soon be vaccinated? And for you, what are the important points people need to know once they get the shot?
What a time for us, Shana, as healthcare workers and as a country. We have a safe, effective vaccine. We're beginning our rollout. Vaccine just arrived to our system, and in 2 days, we're going to begin vaccinating. I think most people, most of the providers are very excited to get the vaccine. But remember, just because you're a healthcare worker doesn't mean there's not going to be some apprehension and some people that don't want to get the vaccine. So we have to be transparent about the process and make sure we answer as many questions as possible.
To that point, Doc, you'll get the shot. Once you can get the shot, you will get it, right?
Ed, you know the answer to that. I cannot wait to get it. Both shots, both doses.
Both, the 3 weeks apart. Trial data shows that a handful of people who have gotten the Pfizer vaccine and a handful who have gotten the vaccine from Moderna developed Bell's palsy, which is, if you don't know, is a freezing and a weakness of the facial muscles. So what do we know about that? And is this something that doctors are watching for and people should be concerned about?
So, and remember, there are always going to be potential rare side effects. We don't even know. There are so few cases. This occurred in about 1 in 5,000 trial participants. And even though it was numerically higher in the vaccine group for both Pfizer and Moderna, the numbers are so small that we still don't know if it's just sampling small numbers. So over time, as we learn about more in the placebo group, we'll know whether or not this is a true vaccine-related complication. No matter what, it's very rare.
Or it could be a societal percentage that we're playing as well, too. It couldn't be not connected to it. Right.
All right, so Moderna just submitted a new claim to the FDA saying its vaccine is actually able to prevent asymptomatic infection of COVID-19, not just symptomatic infection. How is this different from what they were already claiming, and why is this so important?
So, Shana, one of the important parts is not only does the vaccine 94.5% effective at preventing moderate to severe disease. That's really important. Remember, in the Moderna trial, there were 30 severe patients, 0 in the vaccine group, all 30 in the placebo group. But also, if you can show that you are preventing overall infection, meaning asymptomatic infections, then it means you're even more likely to decrease transmissions. So that's where that's important. Again, I think we have to learn more about this before being definitive, but it looks like both Pfizer and Moderna's vaccine have some effectiveness even after the first dose.
So let's talk about length. I mean, do we know right now how long, for example, the vaccine may hold? And are we going to need, I know many of them are double treatments, are we going to need another shot a year from now?
So, Ed, the answer to that is we don't know yet. Only time is going to tell. We still don't know even how long natural infection, after you're infected, how long you're immune for. But it does look like most people are probably immune for close to a year, since it's been almost a year. But remember something, these vaccines are going to turn this pandemic from one of despair, frustration, and exhaustion into one of hope.
What a wonderful way to finish it, Dr. Ellerin. It's great to see you.
Take care, guys.
Thanks for your